I want to just start by saying this is a weekly show, as Mark Levine mentioned, about how counties are leading the local response. There's many levels of government that are responsible for combating COVID-19. The federal government, of course, supporting this pandemic, the state of New York managing the pandemic, and the local governments, the county governments, who are actually executing those orders and implementing their own emergency operations centers at the county-based level. Before we get to our guests, I wanted to talk for just a minute or two about the economy and about the sales tax report. Today, the state comptroller releasing, or yesterday, the state comptroller validating some of the concerns that the counties of New York have talked about over the past few weeks, that in fact, the collections of sales tax was as drastic as we have projected over the past few weeks. We have some counties that are reporting up to 26 to almost 30% of their usual collections in April are down 26 to 30%. So this snapshot of time represents a complete shutdown of the private sector businesses, or the vast majority of the businesses shut down in the state of New York. And it's reflective of the economic and fiscal situation that both the state of New York and the counties are facing as we go through the pandemic. Early on and throughout this crisis, the counties have been focusing on the public health side of it, but so too have we been addressing the economics of the crisis. Early on, the counties, certainly in Suffolk County and also in Chautauqua, had formed economic development advisory councils, or economic advisory councils, to help guide the governments through this crisis and try to get a better understanding of what life will look like as we reemerge through this. So the state comptroller validating that economic impact, very serious and ongoing, which leads now into the federal funding and the crisis in Washington, D.C., and why the governor of the state of New York is asking the federal government to act this week. So too have the county leaders been asking the federal government to act this week. We're very, very pleased to report the actions of the Speaker of the House, Nancy Pelosi, and Representative Nita Lowey, also a New York Congresswoman, introducing the HEROES Act yesterday, a very important piece of legislation which starts the conversation in Washington, D.C., the House of Representatives introducing legislation to directly fund county governments, providing the state of New York with fiscal relief, providing the counties of New York with fiscal relief. That legislation also had many other provisions that are worth mentioning at this time. Broadband, providing public health support for public health data surveillance and testing, an increase for FMAP, the federal Medicaid percentage, an important extension of unemployment insurance for pandemic unemployment insurance through January of 2021, and also providing federal funding for inmates in our local jails. So we encourage the Congress, we need the Congress to act. The 27 members of the New York congressional delegation, in a bipartisan manner, have been advocating for the state of New York and for the counties of New York, and we need that message to resonate around the country. This is a call to the country. The country has to help the states, and the country has to help the counties and local governments of the state, and we ask them to act immediately. The economic crisis is real, and the longer it's prolonged through this, the more serious it becomes for us to provide public services. The governor mentioning very important announcement this week, the reopening plans for New York State. And those plans begin on Friday, May 15th, with certain executive orders expiring for construction activities and manufacturing activities. Counties have been leading throughout this process on the public health crisis, and so too will they begin to lead through the reopening activities. As we know, the state has outlined 7 criteria that have to be met in a very smart data metrics set advanced by the governor based on the CDC guidance and based on the New York State Department of Health guidance. and working with local health departments and county executives across the state through regional control rooms. We'll partner with the state as we move through these reopening phases, and phase one starting Friday. Both of the county executives that are with us here today will talk about their plans in their regions about this and how that May 15th deadline affects these regions of the state and the role of counties. There are two main roles of counties in the seven pieces of criteria, and that is with the contact tracers, and the county executives can talk about what they have done in Long Island and in Western New York about contact tracers and how they have staffed those up already and how prepared they are, and also the capacity for testing. Certain thresholds have to be met as part of these seven criterias, and both counties have that capacity set up right now, and they'll talk about those two pieces. So let's go to the county executives right now. First, let me just frame these regions of the state. Suffolk County, a home of Steve Bellone, home to Brookhaven National Laboratory, over 70 years old. This national, very important laboratory, which has studied the atom, the universe, advanced medical imaging techniques, tools for studying microbiology, climate pollution, energy, could lend itself towards the keys of understanding COVID-19, high-tech corridor in Suffolk County, technology manufacturing, also home of vast coastlines of almost 1,000 miles of coastline, and the Atlantic Ocean surrounding with the Long Island Sound, a traditional family farmers and wineries, make it the biggest agricultural county in the state of New York. You've got it all going out there, County Executive Bellone. Thanks for joining us.
Thank you very much, Steve. It's great to be with you, and I appreciate that highlight of the county. As you know, we're with 1.5 million people. We're the largest population-wise outside of the city, but we're a very diverse county, as you noted, both a suburban county and a rural agricultural county. We're very big, as people who have driven out to the end at Orient or Montauk know. You can probably easily fit Brooklyn, Queens, and Nassau County into Suffolk County and still have room to spare. So very big place and a lot of challenges today for us.
So, County Executive Bellone, you've talked, you were one of the earlier counties who implemented a disaster declaration in early March. When this, I can remember very early on, you went from 0 on Long Island to almost 40,000 infections. You implemented an executive order very early on controlling crowd sizes. You saw something coming early on. What was it that you saw as the rates of infection started in mid-March and all the way through mid-April, where we saw 40,000 rates of infection? What did you see early on when the pandemic came out onto Long Island?
Well, first, I'm joined on this call by our Deputy Presiding Officer of the Legislature, Kara Hahn, and this has been very important in our response. Been working very closely together with our legislature and across party lines. This has been an event unprecedented in our lifetimes that has called for putting aside all partisan political issues or nonsense, as I like to say it at times. Early on, we came to understand very quickly as testing began that, because we were originally contact tracing people who were coming in from China. But as we just started to see testing come in, it became very clear to us quickly that this virus had already been here for a significant period of time, and it probably much longer as time has gone on than we originally thought. But every case that we saw was community spread. While we were contact tracing people coming from abroad, everyone we were seeing had not been abroad, had no connections to anyone abroad. So we knew that we had a real problem here and we had to act quickly.
Again, one of the first counties of the state to put in place a declaration of a state of emergency following the state of New York's declaration of the population of almost 1.5 million residents, moving through and acting as quickly as you did to address these. with the amount of over 70,000 positive rates of infection on Long Island right now, a heroic effort by the county executive of Suffolk, the county executive of Nassau, to implement your emergency operations centers and to convert what you needed to convert at the grassroots level and the community level to address this spread as quickly and as efficiently as you did. You are to be commended for acting so quickly. Can you tell us about the business community and the reopening plans as we go through this? You've recently implemented Suffolk Forward to begin plans to talk about re-emerging from this in the reopening of the Suffolk County economy. I also noted in a short period of time the metrics that Long Island has met. You were at 2 out of 5 of the metrics just a week ago, and you've now quickly jumped to 5 out of the 7 metrics being met. You're well on your way to meeting those 7 metrics. Can you tell us a little bit about where Long Island is right now in the phases of reopening?
Sure. So as this began, of course, this has started with and always is the core of this is a public health crisis. But we very quickly understood that right behind that would be an economic crisis and a human services crisis. And in the middle of all that, of course, is a budgetary crisis for all local governments and state governments as well. So while our focus was always on what do we need to do to save as many lives as possible and prevent our hospital system from getting completely overwhelmed with what was happening here, we also, from the start, were thinking about the impacts on our business community. In March, at the beginning of this, we stood up a business recovery unit that was taking in surveys from our small businesses because we knew that the devastation was going to start and it was going to hit us quickly. From the information we got there, we were able to communicate up to a state and federal partners about what was really needed here on the ground. And so while much of that has been happening, the PPP program and other federal relief bills, we turned our attention to what could we do on the local level. So we partnered up with Stony Brook University, our major SUNY campus here, and really a global institution that partners with Brookhaven National Laboratory that helps to run that operation there. We worked with their College of Business to develop a Main Street initiative under our Suffolk Forward program. And it's basically 5 integrated programs that we are providing to smaller businesses, our Main Street businesses, that really in many ways were struggling even prior to this with the challenges from online shopping and other challenges they were facing. They've been exacerbated now by this crisis. So we're doing 5 different things. A gift card program, it's a one-stop shop to allow Suffolk County residents to pre-purchase goods and services from our Main Street businesses. We're doing a job board so that residents can easily access job opportunities, but most importantly, our businesses. We're connecting it to those Main Street businesses so they have access to talent that they need right now. We are doing a tech enhancement program. One of the great challenges for our smaller businesses was how to transition into this new environment and not having the technology to do it. Now we're going to be assisting them with getting up to speed on what they need to be able to operate in this new environment. We're also doing additional pandemic shift business workshops and a virtual network of experts, business experts, that these small businesses can go online with and communicate about the issues and the challenges that they're facing.
Thank you, County Executive. You have also used Smart 911 technology and had prepared Long Island and Suffolk County, integrating with school districts and the residents of Suffolk County in a very unique way in Smart 911 technology. And you're to be commended for being so forward thinking over the past few years, which lent itself towards really helping identify individuals who needed precautionary quarantine. You yourself were in a precautionary quarantine early on in this pandemic. Can you tell us what it was like to be an incident commander in a precautionary quarantine?
Well, yeah, it was precautionary, and then it became mandatory because we had been preparing for the first case that we would get in the county, in our government. We have nearly 10,000 full-time employees. So we were we knew we would have a case, and we would have to have protocols and shut down the office and send people home and get it sanitized and clean. We're preparing for all that. The last thing I expected was that the first case in our government would be in my office, and it would be one of my deputy county executives. But that's exactly what happened. And when it did happen, there was sort of a silence in the room. And we took a breath, and I said, okay, look, we need to follow the protocols. We are setting the example for what is going to be a long-term event here, and we need to follow that. So I ended up basically quarantined in my kids' playroom, my children's playroom in the back of the house, and managed the first 14 days of the pandemic from that room. No one was happier than my kids to get me out of the house and back to the Dennison building.
Certainly leading by example and setting the example in an early stage. Let's go across the state now. Steve, we're going across the state 9 hours by car. We're talking 500 miles all the way to the furthest part of New York State that you could possibly go in Western New York, to the Chautauqua executive, PJ Wendell. PJ, thanks for joining Suffolk County Executive Steve Bellone and I, and good morning to you.
Thank you. Thank you for having me. It's a pleasure.
So PJ, let's talk about Chautauqua a little bit, about 1,500 square miles. So too, you have a vast amount of waters, not quite the Atlantic Ocean out there, but you have 50 miles of shoreline of Lake Erie. You have lots of lakes out there everywhere in Chautauqua County, similar to Suffolk County. Within 25 miles, you could be on an open water in Chautauqua County. It's a population of about 10% of Suffolk County. 127,000 residents, formed over 100 years after Suffolk County, and home to the county that produces the most grapes and has the most farms with vineyards and wineries, very similar to Suffolk County. The operations of agriculture, very important in Chautauqua, so too in Suffolk County, and also a huge production of sand and gravel and asphalt and cement industries, #1 in Chautauqua County, New York. Tell us a little bit about where you stand right now. You don't quite have those infections that have occurred in the downstate region, but using the governor's smart matrix, which makes sense to protect the people of New York, where does Chautauqua County stand right now in the region that you're in right now with the phases of reopening?
Well, I think what you need to understand is much like the tale of two cities between Chautauqua County and Suffolk County, we still have that same paradigm here between Chautauqua County and Erie County. You know, Buffalo being the largest city outside of New York City, we have not had the number of cases. We have not had the hospitalization rates, the fatalities, and all of the things that everyone else is plagued with. So in our region, we are one of 3 counties, Chautauqua, Cattaraugus, and Allegheny, who are meeting the metrics and ready to open. The problem, or I guess you will, or the frustration is we are linked with Erie County, and that puts us behind the 8 ball. Like Suffolk County, with the number of infections, we have met 5 of the 7 criteria, and we're ready to go. In Chautauqua County, we've met all 7. The testing capabilities are a collaboration between public and private. Congressman Reed has been in contact with my office almost daily. They were able to secure a agreement with Quest to provide as many as 3,000 tests a day for the Western New York region, as well as Finger Lakes and the Southern Tiers. So we've met that metric as far as testing goes. We do not have a hospitalization rate. We've had 2 hospitalizations since the 8th of April, both of which are now recovered and they're out. The newest twist that happened here was we've had our first pediatric case yesterday, and the interesting piece to that was the child was asymptomatic and was brought to the hospital for another condition. They had an orthopedic situation and they had to go into pre-op testing, and that's when it was found. And again, so now we're doing the tracing. The unique piece about our contact tracing is we have over 53, and I just, as before I came on this press conference, had a meeting with our public health director, and she informed me that we are ready to go with 80 contact tracers, which is well above the required limit, or numbers rather, put forth by the governor. So I liken it as a coach. I've got athletes ready to get into the game, and my starters are ready to go, but we haven't needed them because we haven't had that intense game yet. 26 years as an educator and a coach, that's, been a link to this. But uniquely so also, I spent 30 years in our fire service and 26 of those as an EMT. So understanding what's happening, my COVID-19 response team is also made up of 3 physicians who continually are in contact with, first responders in New York City, Long Island. So the data that comes to us is, very effective, very good data. And that's what we're using. And, like County Executive Bellone said, we're looking at it as a health position first. And my obligation was the health and safety of my residents. Now we are switching to the health and fiscal safety of our residents, as well as the physical safety. So we have many small businesses. I've had many contacts with people that are really, in a sense, pulling their hair out, although I can't relate to that. They're very frustrated because we are being held hostage by a larger county, and that's holding us back. We border Pennsylvania on 2 sides, and we are within an hour's drive of Ohio, Ashtabula. We can be in Cleveland in 2 hours. So the ability for our residents to travel is really good. It's great. And the fact that Erie County, Pennsylvania, is a large commerce area in the city of Erie, our residents have already traveled there to shop last weekend. So we're in a unique situation here in Chautauqua County. But, our resources are vast. We work well together. I've got a long, extensive relationship with all of my partners on my response team. So we meet daily. We'll go over the data. We make informed decisions. And as we move forward, it's always based on health and safety. But we are in a position now where we need to get open to save our economy, especially our small businesses here in Chautauqua County.
Thank you, County Executive. I remember speaking to you throughout this pandemic, in the early phases of it and the mid phases of it, how you were tracking the rate of infection and how you were looking at the Pennsylvania and the northern towns in Pennsylvania that bordered Chautauqua and looking at it as a region. The governor, with his matrix that he's included, the 7 provisions in a smart way. We have to follow those as we go into this. We cannot be in a position to fail as we begin these phases of reopening. There's just no room for failure. So we'll continue to work very closely with the state of New York and the regions that the governor has outlined, both on Long Island and Western New York. Mark Levine, let's go to our media partners now and see if folks have some questions for our guests that are with us today. And we'll turn it back to you, Mark, to see if there are some questions.
Thank you, Steve. Thank you, County Executives. At this point, if you have a question and you're a participant on this Zoom call, please raise your hand in the participant section of the Zoom call. And the first one is Amanda Fries from the Albany Times-Union. Amanda, you are unmuted.
Hi, thank you all for joining today. The one question I have for both the county executives, as I've spoken with some who, there's a little bit of confusion when it comes to those regional control rooms as to exactly what the officials on these task forces are supposed to be looking at and monitoring going forward. I'm curious if either of you have had some confusion as well, and what are some of the things that are left unanswered or unclear at this point in time?
Well, let's start with, again, this is an unprecedented event. There's no playbook for it, and we're continually learning new things about this virus as we proceed, including what County Executive Wendell was talking about with the virus affecting kids now directly, which we did not believe was the case in the past. So as we move forward, we're continuing to adjust and adapt. We have now some clear guidance from the state on reopening. That is critical. We know what the metrics are. We know what we need to do, meeting those. And then as we move into phase 1 and reopening, we have this control room where we are working with different stakeholders representing the region and looking at the impacts from that opening. And hopefully, if we do this right, and I think the key is what the governor has done here is very important, and that is the testing. Obviously, New York has done way more testing than any other state in the country. That is critical. And then marrying that with an aggressive contact tracing program, because if we do see a spike in the number of cases, we need to know where they're coming from. It is not enough to say, oh, the numbers are up, because if that's the case, you're looking at having to put restrictions or to adjust the valve, as the governor likes to say. We don't want to do that. When we reopen and as we move forward, we want to continue the progress and keep reopening so we can get our economy back on track. The key to that will be identifying where any new infections are coming from, what are the patterns, and being able to shut that down right away so we're not impacting the larger economy.
And to echo what the county executive has said, where we're fortunate here in Chautauqua County is we do not have a large mass transit system. So our contact tracing is much more aggressive, a lot simpler and smaller in scope, if you will, because we don't get on a bus or a subway or a commuter transit. It's our cars or our vehicles. So our contact tracers are ready. Like I've said before, haven't really been battle tested because our numbers have been low. But the control room, as the county executive said, is to monitor all of that data and information, and watching the valves and gauges. And again, I liken it in years of the fire service. It's watching a pump panel and watching your intake and the water going out and making sure, because as a firefighter, if you lose water, you're in a real peril. So here, the same thing. We're checking those gauges and monitoring, and our group works very close with one another. Our hospitals, our nursing homes are very effective at getting that data to us. We have a constant dialogue. So I think that's a key as we move forward, and it gives that control room a really good idea of what's happening in real time, so we can address the issues accordingly. Lieutenant Governor Kathy Hochul chairs our control room, and she's been very open with us, very forward, and a great leader when it comes to giving us the information we need to help guide this as we reopen. But as Steve had said, we're looking at this in a very responsible way to reopen our economy so that we do not have to take those backward steps should those spikes arise.
Any other questions from the reporters in the audience? Please raise your hand or send me a chat. From Casey. Let me unmute Casey, please. Casey, you are now unmuted.
Thank you. A couple of days ago, it might have even been yesterday, the governor seemed to suddenly say that the counties are going to be responsible for compliance and policing in regard to reopening. Is this something that you were anticipating? And if so, what do you see as happening under that situation? Are businesses going to have a pre-plan before they open, or how are you going to handle that? I just lost my next question, but go ahead.
So we have been working closely with the business community from the beginning, virtually, understanding that we would be getting to the point of reopening. And the question is, how do you do that safely? There's really three keys to reopening safely and not having to slide back, as County Executive Wendell said. That is, we need the contact tracing and testing in place. We need the public to continue to do what they're doing, and that is act appropriately, listen to the health guidance from health professionals, wear those face coverings, socially distance. And then the third piece is to have reopening plans that incorporate all the elements that are necessary to keep people safe, both employees and customers if you're a public-facing business. So all three of those need to be working together. So we've been communicating with the business community about and saying, get ready. We're not ready to reopen, but you need to be thinking about what elements you're putting in place. With respect to enforcement, we've been doing enforcement from the very beginning. Remember, this is all brand new. So we have this situation where the economy is being shut down. We have essential businesses and non-essential businesses. So on the non-essential side, we're policing to determine whether there's anyone operating in violation of that order, whether they're opening their business in violation of the order. And then on essential, we also had our Department of Labor communicating with those businesses to see whether they were following the general guidance that had been put out on PPEs and social distancing, The state will be putting out now more specific guidance for businesses sector by sector. We've developed some of that on the local level. And as that comes into play, we will shift our enforcement efforts to that guidance and making sure that it's happening.
And to piggyback here in Chautauqua County, my sheriff and being a small county, I'm actually a member of the Police Chiefs Association. They're meeting right now with our district attorney and coming up with strategies as, again, a little bit more, I don't want to say volatile, a little bit more challenging here because we are, the numbers aren't as high as you see in Long Island. So we are very concerned as to what will happen if we're not able to meet that metric on Friday. But having said that, you know, the three pieces, 3 weeks ago, before the governor made the statement, I asked 3 weeks ago today, I sent out a letter to all of our businesses asking them to create plans and look at plans they would implement using the CDC and OSHA guidelines as reopening. And we started that. The templates were finalized today. And we've also been in contact with our IDA, our chamber, and our visitors bureau to get that information out. And within a matter of days, within 24 hours, I had several businesses that had already had plans. They brought them, shared them with us. So we have had, numerous plans come to my office, the public health director's office, as well as our senator and assemblyman's offices. And our groups are ready to go. They've been working on this in Western New York for 3 weeks now. We have a unique organization that was started before this called our Chautauqua County Partnership for Economic Growth, a public-private partnership that had 5 work groups, everywhere from workforce development, education, housing, education, different groups. And that group, I asked them to shift gears. So we had the infrastructure there. We now shifted the focus of that group to economic development and now to economic recovery, resilience, and renaissance. So we've been working closely from the beginning. And I've said this several times, and Steve probably could hear it, has heard it several times on our NISAC meetings. I'm listening to everybody else that's gone through this. I'm listening to County Executive Bellone and what they've done in Long Island, what they've done in Orange County, Westchester, Dutchess. So because we haven't been hit hard, I'm taking all their information and data and implementing that into our strategy. So we're ready to go, and we've been working closely with our businesses, and we're going to continue. As Steve said, the state is now giving a little bit more specific guidelines. We will get those guidelines out to our businesses and get them ready to be open. But for lack of better terms, our businesses are chomping at the bit here. We're really anxious to get open. And again, with my lack of hair, I know there are some people that are screaming for beauty salons and barbershops to be open. And, some of the essential businesses that people consider here in our county. But we are working hard with our businesses, and we will continue to maintain that open dialogue and get this ship ready and ready to sail.
So am I hearing that, listening, I'm in Allegheny County. So am I hearing that there is a design in your county to pre-screen businesses or not?
We've implemented, they just were finalized today. We have some templates that are going out to our businesses, and that's through the Chamber of Commerce and our IDA. So those will be rolling out. But the guidance we gave them was simply a link to the CDC website and OSHA's website. And our public health did give some information for restaurants and food processing facilities. And the businesses, our golf courses, our major industries that never closed had already had those plans in place. So they forwarded to them. And the best part, again, about a smaller county is there's a lot of open dialogue. I've had meetings with our larger businesses once a week, and we get the information out. They share those best practices, and it's been very effective. I know Senator Borrello had a meeting, I believe, a week or two ago with the businesses in Allegheny and Cat County, and shared those best practices. So we'll be happy, Casey, if you have any more information to share that with you and get that out to the businesses. As you know, you're part of our region, so the best we can do is work together. I've coined it the unity of effort from my perspective, and we'll continue to work together and make sure we're open on a very effective and safe path.
We put initially we put together a resource guide similar to what the county executive is talking about, which compiled essentially the guidance at this federal and state level to make it easy for businesses to access it. We put it up on our website. We distributed it through our chambers of commerce. But this is basically what we're talking about here is, what are you doing on PPEs? How are you maintaining social distancing? What are your cleanliness, sanitation standards that you're implementing? And what are you doing to protect those who may be vulnerable, who work for you in employment, to the extent that you can continue to have people work from home? That is something that we encourage to happen. And we are going to need to have ways for those who are in really high risk, vulnerable categories to be able to protect them. If they're not able to work from home, we have to have some system in place that's going to allow them to be able to function while the rest of the economy is moving forward.
The next question goes back to Amanda Fries from the Albany Times Union. Amanda, you're unmuted.
Thank you. Just a quick question when it comes to the metrics specifically. Obviously, the state has released that type of data only on a regional basis. I'm curious if in your respective regions you have that information on a county basis. That way you can identify and isolate where there might be issues where you can't keep the metrics at a point for reopening.
We have in Suffolk County, we have a dashboard up that looks at the 7 metrics so that people in the county can see where we are specifically on those metrics. Of course, we're linked with Nassau County as a region. That makes sense. New York City, of course, is its own unique thing when it comes to this virus, as it is in many other ways as well. But the metrics that we have up, the residents in Suffolk County can see where we are at, and then we're linked to the state's dashboard, which shows where the region as a whole, so you can get a look either way.
And that's the same in Chautauqua County. We do have our link to the regional dashboard, and then as well, the interesting piece is, where we are right now, our county has looked at it, and the one area, the region is deficient in our net hospitalizations and also the hospitalization fatalities.
Right.
We have none of the above here in Chautauqua County. The question we have is, we have not had the massive testing like they have had in Suffolk County. So we question that in our county only because we have not had to ramp that up as of yet. We have increased our testing capabilities, but we would tap into the capacity for testing with the partnership with Quest. So in a county position, that's the one area where our experts in the county say we're deficient, but we also feel we're also sufficient in the fact that we could tap into that testing as readily as needed. But the Western region, of course, where those 2 metrics where we're deficient, a lot of it is kind of out of our control in a sense. Testing has been made, et cetera. These are the hospitalizations and then the hospitalized fatalities. So it's a challenge, but I know we are looking at that daily. And Kathy Hochul assures us that that information is looked at, and as soon as we're ready to go, we will be able to open.
Okay, we have another follow-up question for County Executive Wendell from Casey in Allegheny County, and then we will turn it back over to Stephen Aquario after this question. Casey, you're unmuted.
Okay, you are a member of the control room for Western New York. Right now, there are 2 out of 7 pieces that are missing, and you alluded to those a couple minutes ago. What do you realistically see as clearing all 7? In other words, it doesn't sound like it's going to be, from everything I've gathered, it doesn't sound like it's going to be by the end of this week. Or is it? And when do you see it being realistically happening?
Well, I believe the trends they're looking at, they are starting to go down. I haven't seen today's trends yet. As most of us, I think this is my 3rd Zoom meeting today. So when I came in, we kind of hit the ground running in my office. I'm sure County Executive Bellone shares the same thing. But, we are looking at those. And Casey, the hard part is when you're looking at hospitalizations and hospitalized fatalities, those are areas that are, I don't want to say out of our control, but they're very, it's challenging for the counties to, do you not admit people? That's really not a practical, you're looking at the health and safety. And the fatalities, unfortunately, I can tell you from my experience with people in the healthcare industry, they're working vigilantly to keep everybody healthy and alive. So, we are working as hard as we can to make sure those metrics are met. And, I feel confident that we could meet those by the end of the week. I don't have a crystal ball and I can't really, predict, but I feel confident we are watching those every minute of every day. And as soon as we are, able to meet those metrics that, we'll do it, but it'll be, like we've all said, in a very prudent, safe, and responsible manner when it comes to opening. And the piece to that is construction and manufacturing of those phase 1 openings. So it's not like, I know Ohio's at about a 90% opening. They're back to a lot more business and activity than we would be in phase 1. So that phase 1 will be very systematic, and it will start with our low prevalence. So I feel confident that when that ability is given with that low prevalence, we'll be able to monitor those metrics really close and make sure we stay within the parameters.
Thank you, County Executive. Stephen, I turn it over to you.
I just want to conclude by thanking the county executives. We wanted to contrast the state with 1.5 million residents in Suffolk County and 3 million on Long Island and 127,000 in Chautauqua County, but to conclude by saying we're one New York, and we all support each other. We support the efforts of the governor to protect the people of the state of New York. And as we shift into the next phases of the reopening, the county governments as regional leaders are going to be called upon by the public we are going to be put into a position of keeping the community calm and understanding and providing information. And as we head into these graduation months, I wanted to say I've noticed in Suffolk County, Steve Bellone, you have been doing a lot of things with graduations in high schools and colleges and a multi-state effort and using technology in graduations. I think the counties of the United States can learn a lot about this pandemic and what you're doing as we move through it. And some of the things that you have done in Suffolk County have benefited and prepared Chautauqua County and the rest of the state and the counties through your swift actions on Long Island to protect the people of Long Island, and have helped folks all around the country. County Executive Bellone, do you want to add anything on the use of technology with some of the graduations, and how is that being received?
Well, we just recently did our police graduation. We graduated a class of 70 out of the police academy, and normally that is an event where we gather literally hundreds, if not thousands of people together, family and friends, and there's a lot of pomp and circumstance, as you can imagine. Of course, we couldn't do that this year, but we did a Zoom graduation where we had the officers in the academy in different rooms, socially distanced, face coverings on, and room by room we were able to go call out each name. I delivered my remarks, the commissioner delivered her remarks, and it was all streamed live. So we had 25,000 people watching this graduation. We had people, family and friends of the officers all across the country who were watching, who would not have been able to otherwise see it. Some people even remarking that they really liked it this way. And I think it speaks to, out of crisis is one of the things we do, I think, as New Yorkers, as Americans. We figure out a way to adapt and adjust, and at the end of the day, get the job done. And then out of the crisis, we learn and we grow from it. And I think that will be the case here as well.
I'd like to end by a quote, County Executive Bellone. You said to me early on in this pandemic, when there was fear of government closing during the pandemic, and you said, government never closes. No. And you never did. No. And you never will. And congratulations to you on Long Island. We all feel for you and the residents of Long Island and what you've been through and what you're going through.
Thank you.
I'm confident that you will reemerge as a strong society on Long Island. Thank you for joining us. PJ Wendell, thank you very much for joining us and for being so supportive of Long Island and the issues all across the state. We're all for you as well in Western New York and Erie County and Chautauqua County. Thank you, gentlemen. Have a great day. Thank you very much.
Thank you, Steve. Good to be with you, County Executive.
You too, County Executive. Have a great day.
You too.
Thank you, Steve.
Thank you.